I've tried to make it my practice to listen to each video all the way through at normal speed before I inflict it upon you. And I forget things. But right now I'm not gonna listen to them. And I'm not gonna put them up until after I have listened to them. But I'm not gonna wait before I go to the next video. So I'm gonna shotgun these off. I want to talk about Seroquel. I'm going to look that up quickly here on the internet because I don't understand this drug very well. I understand its clinical effects at Seroquel. Seroquel. Drug class. Let's look it up. Oh, it's known as Quentiapine or Quentiapine. Uses and effects. Is it a benzodiazepine? Oh, that's a big deal. I don't think it is. Seroquel is used to treat schizophrenia, major depression, and bipolar disorder. Man, that's pretty much everything, isn't it? These are not discrete categories and classifications, in case you're wondering. They overlap vastly. And it's all a bunch of checklists, baby. So it's not very scientific or very accurate. Plus, we psychologists are stuck with the old traditions and learning and bringing all that old shit forward, which leads us to making mistakes and doesn't help us make real good progress in our nosology, in our body of scientific knowledge. Xanax is prescribed to treat panic attacks and anxiety disorders. And in case you're wondering, the literature on the clinical studies on Xanax, they only published the first 6 weeks of the studies because, and they sat on the rest. They let it go 3 months. They were so happy with their newfound, elixir of life, their newfound wonder pill. They studied it for 3 damn months, and the ultimate result is it caused more panic attacks than it avoided. So it was really pretty bad. It is a major depressant, and it causes one to become very suicidal. And my mentor, Glade Birch, would not allow anybody to stay in therapy that was on Xanax long term. They had to quit it within 30 days or he wouldn't treat them. Why? Because the risk for suicide was just too great. He didn't want to deal with it. That's what his guideline was. Let's go back. Oh, Seroquel and Xanax belong to different drug classes. Of course. I don't know why the hell they put it up there. Seroquel is an antipsychotic medication, and Xanax is a benzodiazepine, a minor tranquilizer. That's the other video. What you need to know is this. My observations are that whenever I had a gentleman or a woman, especially the gentleman, I didn't have female clients on this drug. It was generally for men. But whenever, and I've had pharmacists screw up and give them the wrong medicine, and then they become violent. That's right. And I had one guy in the penitentiaries that showed up in my office saying, "You need to put me on a watch." I'm like, what? The guy's coming to me telling me he needs to go to watch? He knows himself better than, well, of course, I've never met him before. I didn't see him. I didn't know him. He's telling me he wants to be put on a watch. Why? He says, because they put him on the wrong medicine. They took the Seroquel away. And that shit's very addicting. You do not want to play with it. You want to take the minimal necessary dose. But you want to stay in it consistently and every day. Otherwise, you're playing with fucking fire. And you can go very violent with Seroquel. Turns even women into very violent people that are not very well managed. And so those who think, oh, I'll take it if I want, and I'll put it aside, and they don't work with their doctors, and they get prescribed this expensive medicine, which they don't ever take, or they get these huge whopping dosages, which nobody needs but a frickin' elephant, and it's a waste of resources, too. That's not right. If you're going to take Seroquel, then work with your doctor to get on the lowest dosage and take 6 months to 2 years to get that straightened out. And if you're on it, stay on it for your benefit and for the benefit of the rest of us. Because you're much happier, much more manageable. You manage yourself quite well when you're on it. But when it's taken from you, you can't manage yourself. and the rest of us have to suffer. The first guy we had the problem with, the damn pharmacist made a mistake in his prescription. He was in the group home. He was court ordered. He and I had to see each other for therapy. And I established rapport with him in a very unusual fashion. I could tell he didn't like me, and he didn't want to be in the same room with me. So what did I do? I matched him, and I told him the truth. I said, look, I got my butt chewed out. Well, I didn't tell him that, but the fact is I got my butt chewed out because I didn't follow up with him because he was under court order. The guy didn't want to see me. He didn't want to see me. And I'm not going to force that, but he's on court order and it's your job to see him, so I told him. I brought him in. I says, look, neither of us wants to be here. You're on court order, and I'm ordered to take care of you. I don't want to be here either. My God, did that break the ice? Did that open things up? We started working together. I got him on the lowest possible, the least restrictive environment, the lowest dose possible. The guy was doing better than I was in several ways. For one, he had a girlfriend. He was doing quite well in that sphere. And the other thing is that he was working, and he was doing a good job and working hard at it. He was doing well, interpersonally and professionally, in both domains, both spheres. I wasn't. Damn pharmacist made a mistake. Gave him another medicine that began with letter S. Began with letter S, that's right. Began with the letter S, and next thing I know is that one of my favorite case manager, house managers was in the office with me telling me, he's not right. He's become aggressive. And I'm like, she's telling me, I'm going to take, she's my eyes and ears, man. I'm going to take care of this thing for her in particular and for the rest of us too, because she's seeing something. And sure as hell, the next thing I know, she's telling me, we found out the pharmacist made a mistake and gave him the wrong medicine. We got him on the right medicine. Man, he's like a big giant pussycat again. He's a great guy. He's happy. He's doing really well. As Peter Bregan said, the cause of all mental illness is in the social realm. The absolute treatment, the absolute cure, the treatment and absolute cure are in the same domain, in the social sphere. That guy was doing great. Now, he came from state hospital, discharged remotely to my neck of the woods rather than where he was from. He must have really caused some problems down there. I don't know. But all I know is he was doing great in the halfway home and doing great in everything until the pharmacist screwed up and gave him the wrong type of poison. Everything went along real good. The next thing ago, in comes one of my favorite case managers. She's managing the halfway house. And she tells me, John, the pharmacist did it again, and I caught it. He gave him the wrong medicine again. So what's the moral of the story? Make sure you got the right medicine. And pull the pills out. Look it up on Google. Google the pill identifier stuff and see what it is. Now, and then call up the damn pharmacist and say, look, this is different than the last stuff I got. Last stuff I got was a different shape. And this has got some funny numbers on it. I can't even read them. And let them look it up because it's their job. These are powerful things. They are dangerous. Very dangerous. So they made a mistake again with that poor guy. Last I saw him, he was doing great. He was working. He had a steady girlfriend. He was ready to probably transition and go live independently on his own. And I hope that's the case today. And if he happens to see this, I apologize if he recognizes himself, because I'm trying my best not to reveal that. The second guy that shows up at my office, as I said, says, "You got to put me in a watch." What? Security has a cow when I put a man on watch, because they have to take a man from the yard who has to sit there and sit on him and watch him. I really didn't think that part was necessary. I thought maybe a check every, even as much as 15 minutes, but, check every half an hour would be adequate. Unless they were maybe suicidal, then, 15 minutes or sitting on them, fine. The captain, I nicknamed him Captain Teddy Bear. Big dude. And he was a tough guy. And he actually did a good job. Now, I wish that he could have taken care of his problems that interfered with him, because I understand that they had to let him go. And I really think that he was very talented. And I think he was a captain. He earned that rank. And the captain gives me a bunch of bullshit about, why did you put that man on, in front of everybody in the yard office, right? In front of everybody. Why did you put that man on watch? And I didn't even think about it. He's bigger than I am. I stepped into his face, got about 2 inches away from his face. Well, not 2 inches, but I got about a head away from his face. I wasn't threatening him, like a woman will go into your space way too far and violate your space. Man can't do that. I took a step into him, and I said, "Sir, the inmate told me he was about to assault one of your officers. He's on the wrong medications. Our protocols, because we're cheap asses, require him to have clinical failures on several other medications before we give him the good stuff that he needs to be on. He needs to be on that medicine. And he's assaulted 14 people in 2 years since he went down. And before that, in 14 years, he only assaulted 2 people. By his own report. He's out there I put on watch to protect your officers." That shut him up fast. Captain Teddy Bear. I don't think you'll ever watch this, but I apologize. There were times when I teased you in front of the other officers. I didn't really mean to do what I was doing. I just stumbled into it. I couldn't help myself. I had a lot of respect for you. I hope you're doing well. And then I've had other experiences with people on Seroquel that play with it. Don't do that. Seroquel is a dangerous drug. It should have a black box warning on it saying, "Warning, may increase the urge to assault and batter and maybe even commit homicide." That's all I want to tell you about Seroquel. You do not play with it. If you're on it, it's sad, but it looks like it's a lifetime. That's a drug that if they have to resort to that, there's something seriously that the psychiatrist is seeing. Or maybe he just doesn't like you. Or maybe he's just tired of dealing with you and says, "Screw it, I'll fix their ass." I don't know. All I know is that you got yourself into this problem. You need to get yourself out of the problem. Nobody else really, you're not to blame, maybe. Maybe you're not to blame. Okay, let's say you're not to blame. But it's still your responsibility. So may Yahweh bless. This is the problem with discontinuing Seroquel. For whatever reason, discontinuing Seroquel abruptly is dangerous. Goodbye.